Hello, everyone. Welcome to another Lunch and Learn from NAMI Johnson County. We're excited today to have Ryan Crane, who is the Executive Director of NAMI Iowa, and he's going to talk about quite a few things. NAMI Iowa, for your benefit, is a statewide organization which serves as a catalyst around advocacy, education, support, and public awareness so that all Iowans affected by mental illness can lead better lives. And as you might realize, NAMI Johnson County is an affiliate of NAMI Iowa. And of course, there's a national NAMI as well. But Ryan, who joins us today, has 15 years of fundraising, advocacy, and nonprofit leadership. Prior to accepting the role of executive director at NAMI, he successfully led efforts to raise more than $3 million for the renovation of the Children's Theater at Des Moines Playhouse. He has also worked at the Community Foundation of Greater Des Moines, Primary Healthcare, and One Iowa. And in 2025, it's an important year for us. He looks forward to advocating for NAMI Iowa and our affiliates during the implementation of this new behavioral health service organization. And that will really affect the way mental health services are delivered. And will seek partnership and accountability between NAMI and Iowa Health and Human Services on behalf of our alliance. So welcome, Ryan. Get started. I wanted to let all of you know this is being recorded and will be placed on our YouTube channel for later viewing, in case you'd like to share it with anyone. Okay, take it away, Ryan.
Thank you so much, Joanna. I appreciate being with you all today, and shout out to everybody in Lynn and Johnson counties and perhaps around the state who are attending this Lunch and Learn. We appreciate your time. We will keep it brief. I want to leave plenty of time for Q&A and for discussion as well. So we will get right into it. Thank you for the warm introduction, Joanna, as well. So it is going to be a challenging year in the legislature in the sense that we have the ASO mapped out for us. So we'll talk about what that is in a moment for folks who may not know on the call. But the way that mental health and behavioral health will be funded starting July 1st, 2025 will look different than it has looked in the past. And from the perspective of some of the legislators at the Capitol, they are working on mental health. They have allocated the money for mental health, and mental health may not be making a ton of headlines in the 2025 session based on our discussions. They believe that the legislative allocation and the directive that they have given to HHS to coordinate and streamline and flip the or rather implement the to implement the ASOs is more in the hands of HHS now. The legislators believe they have dispatched this to HHS, and again, that is why we are not necessarily expecting bold new mental health legislation in this particular session. But there are always surprises, and we will talk about that possibility as well. So a quick overview. The behavioral health system, which is what I was just alluding to, as well as educational services, that folks receive for their mental health via education, as well as some of the residential services that are going to be impacted by the way that HHS is reorganizing the districts. And then we have a save the date at the end for our own day on the Hill. So the behavioral healthcare system, everyone who we speak to, nonprofit leaders, mental health leaders, legislators, they all seem to know and understand and appreciate that there is a shortage of behavioral and mental health care providers. So we are advocating for the recruitment and retention of a behavioral health workforce specifically. The governor last night announced residencies and rotations for almost 500 specialists, funding for that. And we will be, getting back in touch with her office to see how many of those, I believe she said 460 positions, reading the fine print and seeing what is in store for the mental health workforce rolling up under that. So advocating for peer support models, that is us, nothing about us without us, as our friend Anna Kilpack in Southwest Iowa says. And we are advocating for that peer support because it works. and there is a lower barrier of entry. The peer support models also bolster our workforce. Many providers of mental health services and behavioral health services, and soon to be substance use disorder services, many of them are peers, those with lived experience and or with a diagnosed mental illness. And so as we lift that up as an employment solution, it is, or a workforce solution rather, it will benefit those receiving the care, because there will indeed be better attention paid to workforce, and perhaps even an expansion of that workforce, as I mentioned with the governor's remarks. Also, speaking of expansion, talking about professional development and the destigmatization of receiving mental health services. Many of you know NAMI Provider as a tool. We actually were able to expand the way that we do provider here locally, and we'll be seeing about how else we can plug in with mental health services and other professional development programs that will help educate providers. Perhaps folks on the call know this, perhaps they don't, but it is the case that a majority of pediatricians and primary care physicians and PACs and ARNPs, they are in fact the majority of prescribers of psychiatric meds. I personally didn't know that until I dug deeper into this work, and it's a statistic that still draws my attention, that when you're talking about pediatricians and ARNPs being the ones that establish a psychiatric medical regimen, we got to be educating those folks and empowering those folks to talk more openly and to understand more deeply mental health and mental illness. And so we are excited about more programs, even outside of our own provider registered trademark programs that that Iowa HHS has indicated they're interested in pursuing and expanding. So that's good news in that sense. So education services, as we get to this slide, we're talking about students and staff advocating for programs that address healthcare needs, mental and behavioral healthcare needs of students and staff. NAMI does not take a side or does not take a stand, in the sense that we are not going to take a stand on every K-6 school needs at least X number of counselors per X number of students or whatever. We realize that there is enough of a provider shortage and enough of an acute need, shall we say, among schools, that anything that helps is help. And we will take any help we can get as we look to strengthen and expand mental health offerings in the K-12 school system. Similarly, with whether it's private schools or public schools, we're not concerned with weighing in on that either. We just want more counselors and more mental health providers and mental health professionals, either in the schools or rotating in the schools on a predictable scheduling basis. And in addition to those in-school supports, we're also advocating, we're also advocating for increased access to inpatient and outpatient services for youth. This much we do know about Governor Reynolds' plans. There are concrete, tangible plans to increase bed counts in the state of Iowa. I think it's well documented and well known that we are in the bottom decile, or at the very bottom of the list for beds for intensive inpatient, especially, but also outpatient for youth. And so we have heard the governor express that she understands the need to expand this access. We know it's complicated. Attracting the workforce to rural Iowa is a challenge for everyone. Many folks on this call might have heard it referred to in relation to childcare or preschool. Some folks have heard it talked about in rural hospitals and rural ERs and those kinds of settings. Unfortunately, we are not the only ones, us mental health, behavioral health, substance use folks, we are not the only ones who need increased access to core services in rural areas. The rural healthcare shortage goes to general practitioners and to hospitals as well. So crisis care, we obviously, as we said on the previous slide, are quite inadequate on our bed capacity for psychiatric care. We are advocating for more beds as well as step down levels of care. I can say more about that, or actually Kurt might be one of the most qualified people on the call to speak about that from his own lived experience if he wishes to during comments. But that crisis care piece is really of concern to us here at NAMI, of course. And then permanent housing, medically supported permanent housing in a variety of settings that allows people to thrive in the level of care that meets their needs. So this permanent housing piece is going to get an interesting sidecar, an interesting ride along. NAMI Iowa has not quote unquote committed to supporting this, but we have become aware of some interesting legislation from AARP that will be talking about accessory dwelling units, as well as tax rebates or tax, rebates for individuals who are adults caring for adults in their home who need more intensive care, and in order to keep them at home, their adult guardians who may help them if they are not able to live alone could be in line for a tax credit for their service, really, to help folks that might need extra support to stay in their homes. So stay tuned for what AARP has to offer on that. That was something that caught NAMI's attention over the holidays. Very promising development potentially. And then, whoops. Yes, I thought we were trying to get there soon and quick, and here we are. There is a save the date for our mental health day on the Hill. We will have a registration link coming out very soon. The event will be here in Des Moines on Wednesday, April 2, starting at 9 a.m. Social, get breakfast, get coffee at Curate, which is walkable-ish from the Capitol for anybody who wants to get their steps that day, weather permitting. It's about a 10-block walk. Otherwise, we will rent buses as we do every year and shuttle folks to and from the Capitol. That starts at 9 a.m. on Wednesday, April 2nd. And then starting at 2, we will either walk or bus to the Capitol. We will hang out at the Capitol from 2 to 4. And from 4 to 4:30, we will debrief back at the rendezvous point there at Curate. The morning will be filled with all kinds of sessions. We are still waiting to hear from 1 or 2 of our 5 or 6 speakers, so we haven't dried the ink on that yet, but we are near complete on the roster and the program for Day on the Hill. And as soon as we get that done, that's when we're going to go ahead and send out the registration link. So we appreciate everybody's patience in that regard. The only other thing that might be worth mentioning on this call for everybody's interest would be that we are expanding our Day on the Hill to include a number of state level and local here to Des Moines coalition partners for Mental Health Day on the Hill. For example, MindSpring and the Iowa Mental Health Counselors Association, among others, intend to attend, as well as your friends in Iowa City, Carol Cooey and Kelly McCrory, who was on one of our panels actually last year in 2024. They also plan to drive over for Day on the Hill as well. So we want a ton of folks here. Everybody is welcome. Anybody who wants to be further read in as advocates or wants to further stand themselves up in that advocacy lens are welcome and invited officially to Day on the Hill. We are going to brand it as a mental health Day on the Hill. Of course, we will figure out a way to put our logo on it because it is our event, but we want it to be more branded as a mental health Day on the Hill, not just quote unquote NAMI Day on the Hill. We want it to be broad. So if that resonates with you, if that is of interest to any of your coalition partners, the tent is big and the door is open, and we would love for you to join us for our Day on the Hill. I think many, as I recognize a few of the tiles of the folks who have joined us, I think many of you are pretty well read on this stuff. So one with permission from the host, whoops, excuse me, how did that happen? With permission from the host, I'd actually like to go back to tile mode if we are able, and then open it up for more questions and more ideas, more dialogue. You all are so plugged into the work, and it would not be perhaps even appropriate for me to do all the talking on this call. You guys know a lot about what is going on in the mental health space. One last note, we will be sending out our official advocacy priorities. It was a quirk in timing on our part. The holidays were long and messy. We apologize, but we will be sending out those official advocacy bullets, or those official advocacy priorities next week, and we appreciate your patience. With that, we will open it up for questions with Joanna's permission, and yield to her as the MC.
Absolutely.
So last week I was at the Lynn County Mental Health Access Center Advisory Committee meeting. And Aaron Foster, director of the Access Center, mentioned that because of the reorganization of behavioral health at the state level, that basically the strategy for mental health advocates this year is to try not to seek a lot of changes and let this system settle down and see how it works. Is that what you're hearing as well, Ryan?
It is, and we've heard it enough from enough coalition partners that we feel comfortable saying the same, you know, that conditions on the ground, quote unquote, would suggest that we are not in a strong position to advance bold new requests or legislation. Now, having said that, I was just speaking with someone this morning. It's possible that you know, Representative so-and-so will have some really interesting idea that we love and we want to support. And so we would alert you all as part of our advocacy email blasts. And then, you know, obviously the affiliate EDs and Kurt and others, you know, affiliate boards as well. Hey, Representative Crane has come up with this really neat thing when it comes to substance use. It sounds really interesting and progressive. Let's get on. Right. And that's possible. But I think Kurt, it matches what we talked about at the top, which is implementation is going to be the name of the game for the ASOs.
Be careful with using the word progressive.
Yeah, and I didn't mean that in a political sense. I meant just novel or interesting, right? Yeah, yeah.
Interesting. The problem is that progressive is going to raise the hackles of the majority, the super majority there.
Fair. More careful word choices. Something interesting and bold. How's that? Yeah, fair. Other questions?
Cost saving.
Cost saving. You know, that the workforce
really,
thing.
you know, that's the thing that's going to get them their attention, unfortunately. But
yeah, cost savings. You're right, Joanna. That is true, and it is of much interest to some of our coalition partners and of less interest to others. But it is true. No, but it is true. It is like an objective fact. That's what they'll be focused on. That's right. Additionally, I think, you know, workforce is a lane that we picked deliberately with months of breadcrumbs to indicate that we're on a good track with that one. Because without, you know, we've heard anecdotally from folks that here locally, we've heard anecdotally from folks that it is beds. Full stop, no excuses. We have a lack of beds, but some facilities even have a workforce shortage for the beds that they do have. You know,
right.
those 24-hour. Yeah, Kurt's shaking his head emphatically. Yes. So even though workforce, you know, absent the context, might sound like it's not quite getting to the root of the problem, we believe it is, and so that's why we are integrating it into our legislative priorities. So. Other questions? Laura, I saw yourself take
Yeah, I'll just jump in here with a question. So first of all, thank you so much, Ryan, for being here and for your presentation. I am excited to see the advocacy points that you mentioned will be sent out. But I'm wondering, for those of us who plan to attend the Day on the Hill, just ideas or tips on how to prepare before that day.
Great idea. Thank you for surfacing that. So can I get a thumbs up or a hand raise or a head nod if you know who your local state representative and your local state senator are? Okay. So we will send out a link to educate folks on their local leadership. It seems abstract to a lot of people that we, you know, and all is forgiven. I've even seen people address state legislators and state reps and state senators as congressmen. I mean, right to their faces. So the education piece is important, and we appreciate that. And I think that we will be asking folks to reach out to their legislators ahead of the visit on Wednesday, April 2nd, see if they're around, say, hey, I'm your constituent. I live at, you know, 123 Catalina Drive in your district, and I will be at the Capitol. And you can send that out, you know, a week or two in advance and grab their attention. On a recent call, we do have contract lobbyists. Policy Works is our lobbying firm. And on a recent call, they mentioned that 6 or 7 seemingly organic or seemingly sort of from an individual and not a forwarded email or not a form letter or not one of these, you know, one-click take action things. If they get just 6 or 7 people talking about an issue and they sound like they are all talking about the issue in similar ways, that is very impactful. And so I was a little bit surprised to hear that. I'll admit that our lobbyists are recommending, you know, those grassroots touches to talk about mental health, because it does not take very many organic emails to get on a legislator's radar about a certain issue. And I think it's important for us to mobilize in that way. And we have a plan to mobilize ourselves ahead of April 2nd. So be watching out for cool tidbits on that, Laura. Good point.
Thank you
I
very
have a
much.
question.
Forward to it.
Yes, let's hear it, please.
Yes, regarding advanced directives for mental health. It's something that would not cost anything and would possibly avoid people being in prison and homeless. It seems like if somebody, when they're feeling well, and that could be certified by a psychiatrist, that the person is of sound mind, and if they could, similar to the one we have advanced directive for physical health, where people say, I prefer to, for example, do not resuscitate or to resuscitate or whatever our wishes are. If a person could just have a document saying that I would like to be given this medication or this treatment, for example, ECT or whatever it is, when I am displaying this particular symptom. And then when the person has, you know, goes down and is not feeling well, let's say they're on the street or something like that, then the person could say, the parent or a guardian or somebody could present that document, and then the person could be getting medicine. Because it seems to me very incomprehensible that if somebody has a heart attack, they're on the floor, somebody could administer CPR without asking them, would you like this treatment? And yet when somebody is mentally ill and they're definitely in a crisis, and sometimes just as much risk, perhaps doing overdose or prison or homelessness and all the things that goes with that, but that person can't be giving a medication. So it seems like if somebody had an advanced directive for mental health and they could have this document, perhaps that would avoid a lot of needless suffering. So it's just a thought. And the second point I'd like to make is my understanding in November, the REMS were the FDA ruled that the REMS requirements for clozapine will be no longer required. And I wonder if I don't know if there requires legislation or anything to implement that as well. So those are 2 questions.
For the advanced directive, interesting. I know that NAMI National has some resources on this, and I will follow up with my contact at National to get some more concrete guidance, I guess you could say, on that, because I know that there are a lot of free resources out there, and sometimes it's just a matter of lifting up those existing resources in a positive way. Then the second question, I have to admit, I didn't understand, and I
actually the first
necessary, but
the first question, actually, that wouldn't be addressed by what you just said, because people can have the form, they can fill out the form, that's not a problem. You know, somebody can go legal zone, or they can get a NAMI from another state that has it for them, and they can get the paper. But it would also require legislation to kind of strengthen it. Because right now, the way
Oh.
things are is that people have to go get a hearing from a judge in order to get a treatment, and then very often it has to be a danger to themselves or others. So it's a legal definition for actually a medical problem. And I know sometimes somebody's in crisis, you know, when they're in the emergency room, then they can get held in the emergency room and treated. But before the person gets to the emergency room, that if there was some legislation that would say that this would be an acceptable document, so that the person's home or the person is not necessarily a danger to themselves or others, but they're exhibiting psychotic symptoms, and they have expressed a wish that they would like to be treated when they exhibit these symptoms, perhaps there could be some kind of legislation. It wouldn't cost any money, but it could perhaps avoid some needless suffering. And I would appreciate, you know, because I have, I'm reachable, you know, through it. If you wouldn't mind connecting with me if you have any questions about that.
Yes, I'm sorry. I was taking notes as you talked. I would be happy to follow up with you individually on the first part of that. It was not, I will be candid, it was not on our radar for 2025, but it sounds interesting. So I'd love to learn more. And then the second one, I lost a couple of your acronyms there on the second one. There was a little bit of a breakup.
So there's a medication called clozapine, and the FDA November 19th ruled that these monthly blood tests would no longer be required for people to receive this medication, which is a very good medication to help people, but it's generic now. So it was discovered like 50 something years ago. So it's been in use for many years, and there are monthly blood tests required. They call them REMS. I forgot what it stands for, the acronym, I apologize. But anyway, the FDA November 19th ruled that REMS would no longer be required, but it's right now in a state of limbo because doctors and pharmacists are still kind of confused about whether they can go ahead with that with not requiring it. So it's in a limbo state, and that might need to be addressed. Just that I'm not sure if it needs to be addressed or not, but it's just to put it out there.
Interesting. I thank you. Really, that sounds like something that could get done in rules and would not have to be its own bold freestanding legislation, right? Like that's the good news, that we wouldn't have to break our backs and elevate it as a priority. I think that level of specificity is often hashed out in what is called rules. And forgive my ignorance, I'm not a legislator, please I don't mean to get ahead of myself, but it's my understanding that at that granular level that HHS does have some leeway on what it can, mail out to pharmacies to educate them or what have you. And maybe we could work with HHS at that level to get that bulletin out, so to speak.
Right.
That sounds great. And if it's okay, I'd love to be in touch or follow up on these things, because these are things that wouldn't even require legislation, certainly wouldn't require any money.
Exactly.
But perhaps could just prevent things, which would be wonderful as far as the first point that I made, especially.
Yeah.
Thank you so much.
It often takes a while for things to settle in and get filtered down to your local pharmacist once those.
Yeah.
But you can bet that come February, things are all going to be up in the air, at least on a national level. Right.
Well, with the advanced directive, I think a big impediment with that is that people just don't know, what would the document really require? Does it need to have a doctor, for example, to certify? Will it be accepted? And I think a lot of people are thinking, well, we'll do this document, but then it doesn't really make a difference. The judge is still going to have the hearing. The judge is still going to have to get to the point where the person's a danger to himself. Or maybe it'll streamline it a little bit. But if there could be just some kind of through the legislative process, I don't know how, it might just be a rule like you're saying, or just say that, yes, this document is accepted, just as a streamline. It would also cut court case expenses. There would be a lot of positives.
And I think Mary, or not Mary, but Leslie has been working on these very things. Leslie Carpenter,
Excellent. Yes,
She
and
is, she is a
trying to get
hero,
people to,
wonderful.
truly.
you know, uh, because they're often not able to tell people, tell the providers what's happening to them. Because
If there's anything I can do to be of support of in terms of this, please reach out. Thank you.
Yes, absolutely. Thank you. I see that we are at time, so I did want to be respectful of everybody on the call as well. If there are no other questions or comments, Joanna, perhaps you'd like to close us?
I guess I can do that. Well, thank you everyone for coming. And thanks, Ryan, for letting us giving us an update on what's happening. I know everyone's kind of waiting to see what this new legislative session is going to bring. I've already gotten a few things, alerts from KCRG about language and, things they're already starting to work on, new bills. But thank you very much. And we look forward to hearing more from you.
Thank you. Thank you, everybody. Have a good afternoon.